the meantime, we had another little girl to contrast
Right.
Tula's, health, basically her digestive tract and everything. And so, was there a big difference between the two girls? And
There were. Tula was having diarrhea, um, where her sister was not. Tula, she looked unhealthy. She would have hives. We never found the culprit. She had dark circles under her eyes. As she grew, she was very thin, but with this distended stomach. And then started the behavioral symptoms. So she started stimming, like hand flapping. She had echolalia. So I would ask her a question and she would either repeat it to me or her answer would be about Mr. Noodle, a character from Sesame Street. The cradle cap. So I just thought all babies had cradle cap, and for some reason hers was worse, and she had it till she was about 5 years old. And it was
oh,
so,
wow.
yeah, it was so bad that we would have to use a toothbrush in the bath to try to get it off. And,
It's real common today. I want to interject this too. That's a biotin deficiency, and yeast. They consume the biotin because it helps them grow. If you get rid of the biotin, then they can grow and develop these tentacles to, get themselves established. So it's if a child is born with cradle cap, they are deficient in biotin. I think biotin is one of the many important supplements a mom should be taking. But of course, moms are not told that they do need to eat a certain way. Their yeast infection will be themselves. And of course, if you were, in and out of the hospital as a teenager and so on, having a transplant, a kidney transplant, they would have had you on antibiotics as well. So mothers today have yeast infections. It's just prevalent. And also your immune system's naturally suppressed. Your progesterone and estrogen goes up a lot. Glucose goes up a lot. That feeds the infection, even if she didn't seem to have a problem with it before. So I think one of the causes of autism that no one ever brings up is that our babies are being born with a yeast infection. So what you're saying is exactly confirmation of that, basically.
yes. So yeah, she tantrumed. She was just unhappy. She was very anxious. And I was very scared because before the girls were born, was an academic therapist at a children's hospital. So I had worked with lots of kids with autism. And to me, it was like anything but autism. So a diagnosis really scared me.